Okay, you know what we have? Paul Seegert, managing partner at PCS Advisers, which is an employee healthcare benefits consulting firm based in Northern California. Paul, thanks for coming on.
Thanks for having me. How are you tonight?
Doing well. How about you?
I'm doing great.
So let's talk about this. It's the cost of prescription drugs that is soaring, actually, which is a little bit, it's a trend. I mean, obviously, the cost of food is up, the cost of gas is up, the cost of housing is up. But what can you tell us about this particular price increase structure?
Well, it's been inflationary for some time. It's not slowing down, and there were some actions taken during the last administration to make some moves towards slowing this trend, but they were put on hold when administrations changed to evaluate them and make sure if they were good or in line with what the new administration would like to do. And so some of those things were stopped. And what we've seen historically in the last few years, drug spending was about 30% of what we spend overall on healthcare, and it's the most fast-growing part of what we spend. It's on track to be 50% in the next couple of years. It's tripled what we spend on drugs for a person, say on Medicare as an example, has tripled in the last 15 years. We're spending more than $30,000 annually for each Medicare enrollee to pay for the drug that they're on. And the sad part of that is that a ton of it is unnecessary. Not that the drugs are unnecessary, but the cost. There's a lot of waste hidden in the cost of those drugs that we unfortunately allow in our system.
So you mentioned a RX Price Watch report from AARP that shows that brand name drug prices have been growing faster than general inflation for more than a decade. So that is, a continuing trend that we don't like seeing. What can you tell us about that?
Well, it's interesting. What we hear oftentimes is that the justification for the inflationary increases in the cost of drugs is that it is there to fund research and development. And the truth of it is, when you really dig into those numbers, most of those dollars, the increases in cost, are not going to the manufacturers of the drugs. You have the normal supply chain that we're all familiar with for any product, a manufacturer, a wholesaler, and a retailer. And then you have in the drug industry, in the way that we access drugs as Americans in our insurance payment model, there's pharmacy benefit managers, and those are organizations that help coordinate the transaction and really control shelf space. They manage the formulary for all of the health plans that we're all a part of, whether that's a government-sponsored health plan or a private health plan or an individual health plan. And that's where most of the waste is. Those pharmacy benefit management companies are getting the lion's share of the cost of some of these drugs. If you look at insulin as an example, Humalog is the most commonly prescribed insulin today in America, and when it gets dispensed, the plan, whatever plan is paying for that drug, is paying $550 a month. 330 or 60% of the total is going to these pharmacy benefit managers, not to the manufacturer, not to the wholesaler, not to the retailer. So we've allowed this system to really get corrupted, and we've allowed a lot of waste to develop in ways that are not free market. We don't have a free market, unfortunately, in the way that we're allowing drugs to be sold in this country currently.
So it's the opposite of what we think we have, because most Americans, if you ask them, do we have a free market system for drugs, they'd say, oh, yeah, we do.
Right.
And you're saying we absolutely do not.
Yeah, we don't. We don't have the transparency that a free market requires. Somehow, what we have, it's funny because when you look at Medicare payers or Medicare members, when they go pick up drugs, they might pay $1 or $6 for a generic, yet Medicare is paying much more than other payers, other commercial plans for those same drugs. So it's really, what we've got is a system where we've taken one of the most powerful forces in the world, the American consumer. Everybody in the whole world wants to sell their product to the American consumer, right? We've taken the American consumer and we've shielded them, or put a curtain up between the consumer and the real information. So we're consuming in the way that it affects us. as American consumers, we're consuming in terms of what is my copay. But the unfortunate reality is that we've allowed, through a lack of proper oversight, and I'm a free market person, so saying regulation and oversight is a little bit uncomfortable, but we need transparency, certainly. We don't have that. So then what occurs is the copay that someone might pay could be completely unrelated to the total cost that the plan's paying. And then when we get that renewal for our insurance product, whether we're an individual or a group or whatever, and it's a big, big renewal increase, that's the reason. Because the plan has been overpaying for drugs. Other services too, but drugs is the most extreme example of it in our system today.
So the answer is to make, because you have some tips on saving money on drugs, because Americans are struggling with keeping up with the cost.
Yeah.
Taking on average 4.7 prescription drugs per month, annual cost of therapy more than $31,000 in 2020. This is a huge bill for Americans. How do they manage it? What can they do to save money on their drugs?
Well, don't just go in and pull out your card and pay. It could very well be, and this is an unfortunate reality of our system, but there are many generic drugs which do make up the bulk of the drugs that people take. There's many generics that would actually be, you would pay less if you didn't use your insurance, sadly. So definitely stop and ask. And say GoodRx as an example. Get the GoodRx app on your phone. Use that to see what are the options. Where can I go to get the best price on this particular drug? If you're someone who's listening that's responsible for a health plan and you're managing a health plan, then you need to ask some real serious questions about the pharmacy benefit manager that's involved in your plan. They're a huge source of waste. They're inflating the cost of drugs. Typically 30 to 60% of every prescription is waste, and it can be eliminated. That's tough to do at the individual level, but for those that are in a role where they get to make some of the decisions around how a plan is managed, they can have a big impact on that.
Yeah, that sounds like a great. So the app will give you the opportunity to compare prices. Just simply asking, which most of us don't do that. We just go in. They tell us how much it is. We have the sticker shock, and then you begrudgingly get your card out. HSA card, whatever you're paying with. You fork the money over, and then you kind of grouse all the way home in the car. And then the first thing you do is tell your spouse, or you call a friend and you say, "Guess how much I just paid for X?" And then the friend returns, "Yep, I just paid that for my such and so and so," and you go back and forth. And obviously the prices are high and everyone's paying them. But if you just say, "Is this the best price?" Like what specifically would you ask the pharmacist?
Well, here's the challenge with that, and it's so important, and it's such a big problem that we need to tackle and address as a country. If a pharmacy takes insurance, then they give up, when they sign the contract, they're going to take that insurance as payment for drugs. They actually give up their ability to set their own cash price, which sounds like the opposite of a free market, because it is. So when you go into a pharmacy today and you're going to pick up your prescription, you can say, "Hey, what's the cash price for that drug?" And they're not determining that cash price. The insurance companies and the pharmacy benefit managers and so on that are involved in that transaction get to dictate to the pharmacy what their cash price is that they can sell that drug for if someone is not using insurance. So if you look at a good example of that is montelukast. It's a generic for Singulair and common allergy type medicine. If you were to get a fair cash price, there's a few pharmacies out there that actually don't take insurance so that they can determine their own fair cash price. They're few and far between, but they exist. A year's supply is $34 for that drug. But if you go to most of the pharmacies that we're going to see around in just about every town in America, and you walk in and say, "What's the cash price for that drug?" the pharmacist who takes insurance is going to be required to tell you that it's $400. I mean, it's a massive difference, and it's just a purely made-up number that's dictated to them by the insurers. So it's a really tough needle to thread right now. You can't just use good consumption habits and go in there and say, okay, I'm going to do my darndest, and I'm going to be diligent and get good results. We really have to have some change at a bigger level than that to solve this problem.
So what would you like to see when we're talking about change at a bigger level? Let's be hypothetical here. If you could have the top 3 things you would want, what would they be?
Yeah, well, number one, we need to end rebates. This is a thing that goes on behind the scenes where drug companies, the manufacturers, pay the pharmacy benefit managers a certain amount. Like when I talked about insulin and 60% of it being waste, for the most part, that's rebates that are paid to the pharmacy benefit manager. And then everyone has their hands. A lot of people in the supply chain then have their hands in that $330 out of the $550. So we need to end rebates. That's one of the biggest obstacles we face to setting up a free market. So that would be step one. Step two, we would allow pharmacies to set their own fair cash price. And then if we were to do that, we could see pharmacies compete with each other on cost and quality, just like every other industry has to. And people could truly price shop, just like they do for a TV or a car or anything else. And so we need to end rebates. We need to allow them to set their own fair cash prices. And then we need to change some of the rules around, or put in some better controls around the exclusivity that drug companies get when they make a drug. Orphan drugs are a good example of that. But really any drug, these high-dollar brand drugs, Humira is a good example. It's the most commonly prescribed specialty drug right now in this country. And it's actually passed, technically, if you look at the time limits that they get exclusivity to sell their drug without a generic being in the marketplace, which is supposed to fund R&D, it's past that already. That has expired. Yet we don't see competition in the marketplace here. And if you go across the ocean to Europe, there are 3, 4, 5 generics for Humira already being sold that get good results, that are a fraction of the cost. Instead of $5,000 or $10,000 a month, there may be $300 or $400 or $500 a month. And yet here we're allowing the drug companies to put up patent thickets and do some kind of just put up some difficult walls legally for competition to occur. And that's really not how our system works in just about any other sector of our economy. We've got a fifth of our economy where we've allowed that sector to set its own rules and prevent natural market forces from giving us good results.
So there's bipartisan support for this current system then? Because I saw President Trump sign executive orders saying that he lowered the price of insulin, and he lowered the price of, it was the EpiPen.
Yeah, the most favored nations. We were going to be able to get Medicare, the biggest purchaser of drugs, was going to be getting drugs at the lowest price that these manufacturers would sell them to other countries. And all of that's part of all that stuff that was put on hold when there was a change in administration.
Right. The Biden administration repealed a couple of those. The insulin one, they just straight up struck that down. So the price of insulin went back up. But this is something that I guess the drug makers donate to the political campaigns. So that's how they can get the politicians on their side. Because it doesn't make any sense otherwise for them to say you should pay more for something like insulin.
Yeah, well, agreed. There's so much lobbying. There's so much money spent in this fifth of our economy. And you see how strong it is when you see the Amazons, the Berkshire Hathaways. You have some really major and disruptive, successful entrepreneurs that are disruptive in the marketplace in so many areas that go up against healthcare, and they just fall flat on their back. Or they become part of the problem, like the Amazon pharmacy. It didn't disrupt anything. They're just piling on because it's so strong. There's so much lobbying power in healthcare that it's not. I don't have a lot of optimism that it'll get solved by either political party. When either one has power, there's not a lot of change that occurs around this topic or other related topics The only thing we seem to talk about is how can we argue about how to expand coverage that overpays for drugs or overpays for other services. We'll borrow hundreds of billions of dollars to expand Medicaid. And yet if we would focus more so on the cost drivers and how to clean them up and do some of the things we just talked about, like end rebates and in the ability for these players in the supply chain to tag on 30 to 60% waste to the cost of a drug, allow fair cash pricing, allow competition to occur, we could truly reduce the cost of delivering drugs and other healthcare services to our consumers by 30, 40, 50, 60%. We wouldn't have to print hundreds of billions of dollars to expand Medicaid. We could actually afford to do some of these things with today money.
Well, whenever I hear that lobbyists are involved and donations are being made to campaigns, I kind of understand the fight that we're up against. It's like fighting an invisible enemy, someone you can't see.
That's right.
That is very well armed and, good at fighting, and you're just there kind of punching the wind or punching the air. But I think it's always good for us to be informed, and the most important thing we can do is to understand how it works. And if there's an app out there that we can use that will help us with costs until we can actually get some real solutions, then we have to use whatever is available to us to get it done. Great to have you here. You always bring good information and help to arm us to be better prepared to fight on behalf of ourselves, really, for better drug costs. Thank you so much, Paul Seegert, for joining us tonight, and have a fantastic weekend.
Thanks for having me. Have a great night.
All right, great to talk to you.